Hi, my name is Angie DeBorgia. I'm a physical therapist since 2001, and I've worked in the hospital settings with a lot of great nurses. And I'm here to give you a little bit of an overview of this blog. It's a brief review on an article called Preventing Nursing Back Injuries and Redesigning Patient Handling Tasks. And it's from the American Association of Occupational Health Nurses Journal from 2003, and what they did was identify 9 specific tasks that they found to be most risky for nurses to getting injured musculoskeletally. So what they looked at task-wise and tried to redesign was bathing a patient in the bed, either from the top side or from the underside, making an occupied bed, dressing a patient in the bed, transferring a patient from the bed to a stretcher, and then from a bed to a wheelchair, from a bed to a jerry chair, pulling up a patient in the chair, pulling up a patient in the bed, and applying anti-embolism stockings. So what they did was they actually, with modifications, they found 7 of the tasks to be less strain on the body, and you can read about that below. Even with these techniques of minimizing strain, I think the average reduction was anywhere from 30 to 60% reduction in forces on the body, whether it was the shoulder or the lumbar spine, which is very important. I really still think it's important that we have a foundation of core strength and flexibility, endurance, general fitness that we need to help stay sturdy in our jobs and minimize the risk of injury even more so that we can still be strong and sturdy, be really good leaders of health for our patients, for our loved ones, and prolong our longevity in our careers, because we are definitely in need. Nurses are definitely in need. You are underappreciated, I think, and you're very much spread thin. So but in whatever you do, the take-home message, I think, from the article is elevate the bed to waist level so you're not bending over. Use gravity, incline or recline the bed if you have to pull the patient up. If you have a chair that reclines into a stretcher, that is a huge help when transferring them using a friction reducing device, or using the overhead lift devices that are out there. And according to the article, there's some devices out there that have harnesses incorporated into the hospital gowns or even the bedding. So I would be interested to hear about that. That's a great idea. I know that they are doing more of overhead ceiling lifts in the ICUs and everything. So but thanks for coming by. Please read more about reducing risk for back injuries by redesigning patient handling tasks. And again, get fit with me and reduce your risk for injury. There's plenty of workouts here on my website, angiedeborgia.com. I love P90X. I love Turbo Fire. I've gotten stronger in my core. I feel stronger. Shakeology is awesome. It has taken away my cravings. I've gone down from a size 10-12 to a size 6-8, and everything has just kind of compacted down. So feel free to ask me any questions, send me an email, or ask me a question through my website, and I'd be happy to help you out. All right, take care. Bye-bye.